Hey, what's up everyone? Dr. Asher, physical therapist here. Today I'm going to be discussing and showing you 3 exercises to do before going into a knee replacement surgery. I would say do these anywhere from 4 to 2 weeks out from your surgery. Let's get started. So the first exercise you're going to do, I like to take a big beach towel. You can use a smaller hand towel if you want. And you're just going to roll it up into a nice oval shape. You're going to bring your surgical leg, the leg you're getting surgery on, prop that up at the ankle, okay? We're not putting this behind the knee. So my knee is about here. This towel is way down at my ankle, okay? You can do this laying in your bed. You can do it sitting on the couch. I'm just using this gym bench here because it's set up and it's easy for me to demonstrate with. So what you're gonna do, the first thing, you're gonna try to really squeeze that quad muscle, trying to push the back of your knee straight down and actually get it to touch the surface that you're on. So the bigger your towel is, the more difficult this is gonna be, and you'll probably feel a really big stretch along the back of your knee, and that's exactly what we want. Going into a knee replacement surgery, you want to have as much range of motion in both directions. So extension this way, straightening, and bending, which will be the next exercise that we work on. So this one here, towel roll underneath the ankle. You're squeezing your quad and holding, pushing down as hard as you can with just your leg muscles. And then as you're squeezing, find your top of your kneecap with your hand, slide up just a bit, just a ½ inch to an inch, and just apply a very light, gentle pressure as you're pushing down, okay? As you're squeezing the quad. Squeeze and hold 10 seconds, and then relax. Back again, squeeze first, and then apply your gentle pressure. Don't push so hard that you're causing pain. You're just trying to get a little bit extra range of motion through that joint, and the more range of motion that you have going into surgery, the better off things are going to be on the other side. So the second exercise we're going to do, you can actually use that same towel, just wrap it around your foot and use it to pull, to bend. I have a stretch strap because I use it very frequently with a lot of patients and clients that I see for stretching and joint mobilization, stuff like that. But so you're just going to take that loop around the foot, or you can take the towel, wrap it around, and all you're going to do, you're going to actively try, so I'm not helping with my hands here at all, you're going to actively bend your knee as much as you can, so you're really using that hamstring. And then when you get to the end, you're going to try and pull just a little bit more. You can help with your hands here, pull, hold for about 10 seconds, and then extend all the way back out, okay? This one I would say do anywhere from 10 to 20 times, but make sure you're really actively trying to bend your knee and use your hamstring as much as you can, because passive motion is great, but if you can't control that range of motion or get there yourself, it's not really going to benefit you a whole lot. So hold and then relax. So that's the second one. The third one is more of a quad strength, hip flexor strength exercise. And there's some variations that I've done in some other videos, but I'm just gonna show you guys this one, which is a very good starter exercise. It's probably not a day 1 after surgery exercise. It's probably more like a week 2 type of thing, like day 7, 8, as you start to get stronger. But this is a very important one to do before surgery, because the stronger that your quad and your hip flexor are going into that surgery, the less pain and weakness you're going to have on the other side of that surgery. So let's take a look at this one. So this one, same idea as the first one. You're going to really squeeze your quad, and you see how my foot comes up off of the bench here? This is a hard enough surface that will happen. If you're on a couch or a bed or something, that might not happen to you because your leg is kind of sinking in, and that's okay. Ideally, you do want that because you're getting full extension. You're actually getting some hyperextension at the knee. You might not have that range of motion, and that's okay because you're having a knee surgery. So you may be limited in extension, but you may also be limited in flexion. So just be careful with that previous exercise too. But here, squeeze, lift that ankle up, sitting up nice and tall, and you're gonna lift and go down, lift and go down, lift and go down. Okay, so that's the third exercise. And this one, I would say do 10 to 15 and do 3 to 4 sets of that, especially on that surgery side. I would do them on both sides just to make sure that both are getting worked, but pay special attention and really try and squeeze and get those muscles activating all the way down the leg to make sure that you're getting the full effect of these exercises. And again, these are all exercises that I would do anywhere from 2 to 4 weeks out from surgery just to get the knee prepped and ready to go. These are all stuff, if I have anyone that I know is 1 to 2 months out from a knee replacement and I'm seeing them for any prehab stuff, these are all staples of our program, kind of regardless of where they're at activity-wise, because with all of these exercises, they're all self-controlled, so you really get out of it what you put into it. So the more you're trying to squeeze, the more range of motion you're trying to get within a tolerable range, the better off you're gonna be. So I hope you guys found that helpful, and that gives you some exercises to do before going into your knee replacement surgery. If you're looking for a video on what exactly to expect after a knee replacement, please check out this video. Otherwise, until next time, stay moving, stay healthy.